As part of our preparation core, pathway for the examination of the PT license, we need to answer some questions on the different topics. And today topic, I am bringing you one of the questions related to cardiopulmonary. Okay, my name is Dr. Mohamed Kamel. I'm Associate Professor of Physical Therapy, University of San Augustine, United States. And today, this is our question today. A patient began taking a new medication 2 weeks ago and now reports a new onset of the following symptoms: resting muscle pain, flu-like symptoms, and generalized weakness of the arms and legs. Which drug class is most responsible for the patient's symptoms and presentation? You have a patient who started new medication 2 weeks ago. Most of the medications, they have side effects, and these side effects are variable, could be minor, could be major, but overall we need to understand what the side effects for the medication, because you are the most frequently healthcare professional who is seeing the patient. So if the patient, if you see any of these side effects, you might need to call the physician or ask the patient to call the physician to adjust the dose, to change the medication. And so our patient today have resting muscle pain, flu-like symptoms, generalized weakness of the arms and legs. Which drug class is most responsible for the patient's symptoms and presentation? Anticholinergics, proton pump inhibitors, selective serotonin reuptake inhibitors, or statins? This question is pharmacology and at the same time is related to cardiopulmonary. And one of the major side effects of statins are muscle breakdown or rhabdomyolysis. So the patient have rhabdomyolysis or muscle break. Statins are medications which used for lowering blood cholesterol and blood lipids. Okay, so these are the side effects of statins. But let's look at the other options too. So our correct answer is statins. Answer number 4. One of the most common adverse effects of a statin, which is a class of medication, concerns skeletal muscle, affects skeletal muscle pain at rest, weakness, and other constitutional symptoms presenting within the first few weeks of starting the medication may indicate muscle breakdown. Muscle is getting broken, and possibility of rhabdomyolysis, which is the same term of muscle breakdown. Okay, but let's look at the other medications listed here. Anticholinergics. We use question answers and rationale for learning about the topic. We just not go through knowing the answer. We need to answer to understand more. So when the question comes in another format, we understand how to answer this question. So anticholinergics are a type of medication that blocks the action of a neurotransmitter called acetylcholine. So acetylcholine is one of the neurotransmitters. Okay, and anticholinergics are drugs which block the action of acetylcholine. Acetylcholine transfer signals between cells that affect specific body functions. Okay, anticholinergics and antispasmodics are used to relieve these are the indications: relieve cramps or spasms of the stomach, intestines, and bladder. Some are used together with antacids or other medicines in the treatment of peptic ulcer as well. And others of anticholinergics are used to prevent nausea, vomiting, and motion sickness. Okay. What are the common side effects of anticholinergics? The common side effects include dry mouth, constipation, urinary retention, bowel obstruction, dilated pupil, blurred vision, increased heart rate, and decreased sweating. Okay, so these are the like anticholinergic or anti-parasympathetic system, because like you are blocking the action of the parasympathetic nervous system, which is, a branch of the autonomic nervous system, and you know that. The next medication on the list, which was a wrong answer, was proton pump inhibitors, or PPIs, are medicines that work by reducing the amount of stomach acid made by glands in the lining of the stomach. Somebody have too much acids, and this will lead to peptic ulcer or whatever complication within the stomach. So they get a prescription from the physician for proton pump inhibitors. What are the side effects for proton pump inhibitors? Headache, rash, dizziness, gastrointestinal symptoms including nausea, abdominal pain, flatulence, constipation, and diarrhea. These are rare contraindication, because usually proton pump inhibitors are well tolerated without complications, but for if the patient has a problem, it could be these side effects. The last one is selective serotonin reuptake inhibitors, or SSRIs. These are widely used type of antidepressants for people who have depression. The possible side effects of SSRIs may include, among others, nausea, vomiting or diarrhea, headache, drowsiness, dry mouth, insomnia, which is lack of sleep, nervousness, agitation or restlessness, dizziness, sexual problems such as reduced sexual drive, difficulty reaching orgasm, or inability to maintain an erection or erectile dysfunction. Okay, so but let's go back to the answer of our questions. So the side effects which our patient have is related to statin side effects, and statins are blood lipids or blood cholesterol lowering medications, as it has side effects like muscle breakdown, and muscle breakdown will appear in the form of muscle pain at rest, weakness, and other symptoms which will appear within the first few weeks of the patient starting on statins. Okay. If you need to join our course for the preparation of the physical therapy license exam in United States or Canada or in the Gulf area or Australia, please send me a message on WhatsApp number 00201159882370 or 00201027743702. Also, if you need to fill the application for PT licensing in United States or Canada, please send me a message on the same numbers. Okay. And the last thing for PT graduates from Egypt or Sudan, Jordan, or Palestine who are interested in joining the TDPT program at University of Montana in United States, which are discounted by 50% for people who are from these countries and living in the same countries, please send me a message also. Thank you. And I will see you in a new topic, new question soon. Thank you.